So we talked earlier about the South Asian population and that they face a much higher risk of developing diabetes, metabolic syndrome, premature coronary artery disease compared to these other populations. So from a clinical perspective, what factors contribute to this elevated risk?
Yeah, I mean, this is a real big problem. Uh, South Asians make up 20 to 25% of the world population, yet they account for 50 to 60% of the cardiovascular morbidity and mortality. So they outweigh the risk. They have heart disease 10 years younger than other populations, which is astronomical. So the 50% of coronary disease deaths occur before age 50 in the South Asian population, and 25% occur before age 40. What that tells us is we need to be looking earlier, screening earlier, treating earlier in this population to improve risk. Now, one of the biggest risks is the metabolic syndrome or prediabetes or diabetes, which tends to occur without as much truncal obesity, meaning the belly weight. So the measurements for metabolic syndrome are actually lower for South Asians than they are for the rest of the world to determine it. Now, they still have a lot more what we call visceral fat, meaning the fat in the belly that gets into the organs, despite having not a very big waist size. So and one of the reasons is there's less muscle mass. So that tells us also South Asians need to be exercising more. There has been some sedentary behavior in a lot of South Asian population, and really getting out and exercises to improve muscle masses improves this metabolic syndrome or this pre-diabetic. The rate of diabetes is going up astronomically in South Asians. So we really have to address that's pre-diabetic with both exercise and diet and sometimes medications, and certainly aggressive medications if already diabetic. So the lipoprotein A, which is elevated a little bit more in South Asians, needs to be looked at and eventually addressed with medicines, but now with aggressive lipid-lowering therapy. And so the Indian National Lipid Association has come out with guidelines in 2023, which can be looked up, and it's very much more aggressive than the world or national guidelines we have elsewhere. Their targets for LDL reduction occur earlier in life and more aggressively on the risk assessment. So maybe for me as a Caucasian white person, I might not be as aggressive on me as it would be on a South Asian that has the same risk profile, just because they have disease 10 years earlier than other people. So yeah, it's a real problem that is not addressed as aggressively needed. And the part of the problem is South Asians tend to have very aggressive, particularly if they have a family history. So if a South Asian has a family history of premature heart disease, let's say a heart attack in the 40s or 50s in a male or female, and then that daughter or son really needs to be looking at their numbers, being more aggressive in their risk assessment and treatment because of that high risk of premature heart disease.
Yeah,
You know,
yeah,
I don't know if that
yeah.
covered it adequately.
No, that was
It's
great.
hard.
Yeah, yeah.